I'm Dorina Uko. I'm a family planner working for the county government of Nakuru. Also training nurses in service, short course on the same reproductive health. So when a client comes to seek for services for family planning, we do comprehensive history taking. Then after that, we do physical examination. So physical exam, we look at the breast and also to detect any abnormal growths or the lumps. Then we do other exams which are a bit private, the internal organ like the cervix. So after that, we take the woman through counseling of the available family planning methods. Then she'll be able to choose. After she has chosen the method of her choice, the informed choice, because we'll have given the information of all the available methods that we provide. Then the chosen method will be able to elaborate further into details now. Then if there will be no any limitation, then we go ahead and give the mother, then we give her the return date. Then for us to ensure that the woman is well protected and is able to prevent pregnancy at all costs, we have the following methods. This is, as you can see, this is a barrier method. We have female condom and the male condom. As I've demonstrated when it is in place, that is how it's supposed to be. Then the male condom is used by the male. We normally just teach them how to apply, because many times they break, the condom bursts because of the poor technique of application. Then here we have the emergency contraception. Emergency contraception we give to people who have had maybe burst condoms or who have had unprotected sex and they are fearing to be exposed to pregnancy, unwanted pregnancy, or in event of a rape, we give the emergency pills within the 72 hours is best. Then here I have the short-term method where we have the injectable one for 3 months. We also have pills. Pills we have for 21 days, 28 days, and 35. For 35, there are mothers who are using, these are the breastfeeding mothers, and these ones can be used for mothers breastfeeding 6 months onward or non-breastfeeding mothers. Then here we have the long-term method. This is just a model of the womb, how the womb looks like. So this is the coil. So when a coil is inserted, it lies the womb, the upper part of the womb. And people normally fear that it will interfere maybe with the sexual intercourse. It's quite far, so we only leave the thread suspended for purpose of examination, just to check if it is in situ, and also for removal purposes. So it may appear long here, but a normal uterus, you leave about 3 centimeters there, okay? So we have various type of ICD, the copper one, the plastic, the Mirena, and even the ones with the hormones. So they are different types. So here also this part, we also have long-term method, but now for the implants. Implants are the I can call them the capsules that are placed under the arm of the women. We have for 3 years, we have for 5 years. Once it is placed, then the body absorbs bit by bit of the hormonal that suppresses the ovulation, and the woman will be able to stay free from unwanted pregnancy. So basically that is what we have. We also have what we call medical eligibility criteria. This one we know we have medical conditions with women, and this one guides us on how to guide the mothers on the chosen method. If you have maybe hypertension, it will give you, for example, hypertension. It will give you which method you can use, which one you can avoid, so that you are not limited to accessing the services. There will always be at least another option, even if the preferred method you are limited due to a medical condition. Okay, so that is just an example. So if it is 1, meaning 1 is good to go, you can use. If it is 2, meaning is guarded but you can use. 3 and 4 you should not use because of your medical condition, surgical condition, or any other condition that you have that will limit you. So this one just improves the quality of accessibility of the available methods that we offer in Kenya. So another one that we have that is not displayed here, we call the permanent method, where we have the vasectomy and the tubal ligation. Vasectomy is for men and tubal ligation is for women. Here, basically what is done is just cutting off the tube so that if for female, the eggs may not travel for fertilization. Same to men, they will continue function as men sexually, but what is now blocked is the semen part of the sperms. But the man will be able to release the semen and just active. There are myths and misconceptions surrounding that, but if someone is interested, can be explained to further when they come to the institution. Thank you.
Okay, maybe when we talk about family planning,
Yes.
do you have a method that maybe you recommend? Maybe for someone younger, does it go by age or anything can work for anyone?
Yes, we have methods for young people. We have also policies guiding us on the young people. Basically, what we do to the young people, we advocate for abstinence, okay? Where it is not possible, then we tell them to use the barrier method, that is the condom. Because condom will prevent pregnancy, at the same time will also prevent the sexually transmitted infection. So that is what we recommend for them. Yeah. But if there are those who marry, they are underage, but you find that they have children, they are sexually active, then they are not limited. Any method of their choice, so long as they have proved their fertility, then they can be issued with the method. Yes.
Okay, and in all these methods of family planning, which one can you say is the Kenyans have wameikumbatia sana, they prefer? Do they have a method that you think Kenyans prefer than the other?
Yeah, statistically we have seen most ladies, they like injection. I think it's easier, it takes shorter time other than the long term that maybe you'll go through a procedure. So, and it can also be given at all levels, including the lowest level of the healthcare system, like the dispensaries and all that, and mostly available all the time. So they prefer that, but I can say all the methods are good, and we tell mothers to do method mix. You can use a method this time, and after some time, maybe you have terminated due to a pregnancy. After you have achieved a pregnancy and after delivery, you can always try another, so that you have various options. Yes, but they are all good, but depending with the condition of an individual client. Thank you.
Okay, yeah. Kuna hizi discussions sometimes I see online.
Yes.
That a woman says that alienda akapewa a certain method of family planning.
Yes.
But the effects that inatoa that sexual utasema ile hamu ya kuwa na ngono, yani ina make to be that so called in that area. Is it true, ama those are just stories?
Those are myths and misconceptions, okay? Because sex is in the mind. Even women who are not using any method of family planning, when they are not in the mood, it's not that they are using any method of family planning, but it is in the mind. Maybe kuna other factors that may be disturbing one, maybe with a spouse and others, that can make a woman to lose the desire in sex. So I don't think it is the reason. I used to ask mothers, when you say someone is cold, is it the body temperature or the desire to have sex? So when I realize they mean the desire to have sex, then we do explain to them so that we dispel those rumors. Those are just myths, yeah? but it is not true. Yes.
Okay, maybe the last one we talk about this one of the long-term methods of family planning.
Yes.
Iko aje ukisha insert kwa mwanamke. I don't know, juu kuna wakati kuna a certain picture ilikuwa inatembea social media.
Yes.
Ilikuwa iko na this last part,
the thread.
Yes. Sasa na mtu alikuwa anasema ati maybe ni mama alikaa chini, gari ikaruka ikatoka. Is it possible for this thing to
come out?
Yes.
No, because anatomically where the womb is situated is actually inside, because that is the same womb that carries pregnancy. Okay, unless there's a problem, maybe cervix is open, and during examination and insertion, we can never insert in certain conditions where somebody has a very small uterus or their laxity or some anatomical structure problem. We cannot insert. Actually, once it is inserted, the muscles there, they contract and they hold it in place. It can never come out unless accidentally. Women who used to use tampons that I don't think are no longer there. The thread, at times when the messes are so heavy, then as they were removing, because the tampons was being inserted inside the vagina, if it could go higher up, then I think in times of removal, that is when it could be dispelled. But in a normal situation, it cannot come out, because the size of a uterus for every woman is the size of a fist, okay? And it is elasticated that during pregnancy it can expand. In the absence of pregnancy, it's just that small. And because this is a foreign object, once it is inserted, it tries to contract. So it is held in place. Yeah.
Okay. So maybe Daktari, your last word to the youth?
Youth?
Yes.
Mine to the youth, I say, we love them. They have a future to protect. We are telling them foremost to abstain so that they achieve their educational goal. After that, then they can marry, okay? But in cases where unfortunately someone has been sexually abused, maybe conceived, or because of other reasons they have gotten involved, there's always secondary infertility. You can always abstain, even after having been exposed, now that you have the information, because early sexual debut can also lead to cancer of the cervix. So STIs, HIV, among others, that will even prevent you from having babies. Okay? So do not go for morning after pills or the e-pills. Ideally, that one will suppress your eggs for life, that in future when you get married, you'll never have children. So if it is a must that you must have sex, then use a condom. But it's best to abstain. You can prevent a pregnancy using emergency pills, yeah, but you'll not prevent other sexually transmitted infection that will give you even infertility in future. So you better protect your body from those infections so that in future you'll be able to have a family. Yes.